The role of exercise in fighting against diabetes. Exercise alongside medical nutrition therapy forms the cornerstone of diabetes therapy. Regular exercise is associated with prevention and minimization of weight gain, a reduction in blood pressure, an overall improvement in insulin sensitivity and glucose control, and optimization of lipoprotein profile. American Diabetes Association recommends the following physical activity participation for people with diabetes. For asymptomatic individuals, pre-exercise medical clearance is generally unnecessary prior to beginning low or moderate intensity physical activity. Most adults with diabetes should engage in 150 minutes or more of moderate to vigorous intensity activity weekly, spread over at least 3 days per week, with no more than 2 consecutive days without activity. Adults with diabetes should engage in 2 to 3 sessions per week of resistance exercise on non-consecutive days. Shorter durations of vigorous intensity or interval training may be sufficient for younger and more physically fit individuals. Children and adolescents with type 1 or type 2 diabetes should engage in 60 minutes per day or more of moderate or vigorous intensity aerobic activity, with vigorous, muscle strengthening, and bone strengthening activities included at least 3 days per week. Flexibility training and balance training are recommended 2 to 3 times per week for older adults with diabetes. Yoga and Tai Chi may be included based on individual preferences. Individuals with diabetes or prediabetes are encouraged to increase their total daily incidental physical activity to gain additional health benefits. To gain more health benefits from physical activity programs, participation in supervised training is recommended over non-supervised programs. Exercise and weight loss is important for prevention of type 2 diabetes. The incidence of type 2 diabetes is inversely proportional to participation in physical activity. There is a strong association between increased physical activity and prevention of weight gain and weight loss. Moreover, exercise aids with diabetes prevention even if weight loss is not achieved. Beyond the effect of weight change, analysis showed that increasing fitness had a beneficial effect on fasting blood glucose, glycated hemoglobin, and other cardiovascular risk factors. An individualized approach is key to achieving the desired benefits of exercise, such as improvement in weight, glucose control, and endurance. Exercise can aid in glucose regulation by augmenting glucose disposal and improving insulin action. Muscle contraction and the resultant blood flow increases the rate of glucose dispersion into the muscle interstitial space. Exercise training increases skeletal muscle glucose transporter translocation expression and augments insulin receptor signaling and oxidative capacity, which optimizes insulin action and glucose oxidation and storage. Muscle glycogen stores and exogenous glucose are consumed during exercise, leading to a glucose and glucose 6-phosphate gradient that favors glucose entry into the skeletal muscle. Through molecular changes in skeletal muscle signaling, exercise can impact glucose homeostasis for up to 48 hours. Exercise leads to better glucose uptake through both insulin-dependent and independent mechanisms. Therefore, routine moderate exercise usually improves sensitivity to insulin in individuals with type 2 diabetes. Beyond the therapeutic and preventative benefits of exercise, exercise also holds great prognostic value for people with diabetes. Capacity to exercise has been shown to be predictive of mortality in people with diabetes and in the general population. Similarly, decreased exercise capacity in people with type 2 diabetes is associated with development of future cardiovascular events. Higher levels of physical activity have been associated with reduced complications in diabetes. While exercise can be beneficial, it can also be deemed as acutely dangerous for people with diabetes. Since exercise increases both the translocation and expression of the glucose transporter and greatly increases the metabolic demand for glucose, hypoglycemia can be an imminent possibility and danger. Insulin dose reduction and consumption of carbohydrates can help limit the risk of hypoglycemia. The exercise modality practiced may also have effect on risk of hypoglycemia. Resistance exercise tends to cause an acute increase in blood glucose superimposed with a subsequent increase in insulin sensitivity. Aerobic exercise causes a larger initial decrease in blood glucose but somewhat less sustained hypoglycemic effect. However, resistance exercise is associated with overall less blood glucose variability post-exercise. Regular exercise is associated with lot of benefits for diabetics. However, the exercise program should be supervised to prevent hypoglycemia and other complications.